social worker is feasible.
Well, every police department was required to submit an evaluation by this past February to figure it all out.
Yes, but Channel 3 Eyewitness News reporter Sharon Johnson dug through the reports and uncovers why a majority of the departments say no.
But we don't need somebody with a gun and arrest powers when our loved one is facing a mental health crisis.
In response to the nationwide protests following the killing of George Floyd in 2020, many activists demanded social workers replace or work with police officers, especially during mental distress calls. The state's police accountability bill asked each municipal police department to, quote, complete an evaluation of the feasibility and potential impact of the use of social workers by the department for the purpose of remotely responding to calls for assistance, responding in person to such calls, or accompanying a police officer on calls. Here's what we found. 24 departments value the idea. 16 departments said they'll consider it if they can receive more resources and do more research. 41 departments said no, citing safety, lack of money, and lack of 24/7 coverage.
My concern is you're going to then have competing senses of what needs to happen next, and that the police officer and social worker may even be at odds.
Quinnipiac University professor Dr. Amber Kelly works with several community groups in New Haven. She says a collaboration could be tricky.
What I have heard from community members is, if we see you show up with police, you are the police. It doesn't matter whether you have a uniform on or not.
The Connecticut chapter of the National Association of Social Workers agrees that there could be some obstacles, but recommends all police departments have access to social workers. It also recommends more state funding for those employees and for mental health resources. A majority of police departments requested the same in their evaluations.
We don't want the police to be all things to all people. We want the police to actually be the police. So if we can get mayors and city managers and city councils to reallocate some resources towards mental health, that kind of frees up the police.
Community policing expert Dr. Lorenzo Boyd says working with trained clinicians could make a major difference.
They'll be able to diagnose what's actually going on and be able to de-escalate it a lot differently than the police can.
Police departments suggested several collaboration models in their evaluations. It included embedding social workers in the department, contracting community organizations, and creating multi-town crisis response teams to pool resources.
So it's not only is it feasible, but it's crucial that we do this. We need to move forward with this.
That was Sharon Johnson reporting. Now, as of today, 12 departments have not submitted their evaluation. Coming up tonight on Eyewitness News at 11, find out what the Police Chiefs Association thinks about all this, of departments missing the deadline, and how one department in our state has been partnering with a social worker since 2019.